Hello, and welcome to Med Evidence Articles, where we encourage community research and education with weekly articles. I'm your host, Benton Loeyball, and this week we're talking about how and why walking is such good exercise. Improving your health one step at a time. Walking outside is great. You get to see nature, friends, and cute doggies. Walking inside on a treadmill or walking pad is also great. You get to listen to podcasts, like this one, raise your heart rate, and maybe even burn a few calories. Well, actually, a lot of calories. My walking pad claims I burn a few hundred calories an hour when walking briskly. Actually, walking is a great exercise and is severely underrated. One of the best parts of walking is that, for those without disabilities or other impediments, walking is easy. Keeping the head up, back straight, elbows bent, and stomach slightly flexed is great, but walking in any fashion you can is better than not walking. Unfortunately, in high-income countries like the United States, over 40% of adults, especially women, do not get enough physical activity. The World Health Organization recommends at least 2.5 hours, or 150 minutes, of moderate intensity exercise a week, with lower amounts needed for more strenuous exercise. To reach this goal, you could buy weights, get a bench, find a spotter, set up a couple plates, blah, 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 or just put on some shoes and walk for around 30 minutes a day. Walking can provide health benefits similar to those of other exercises. Like other exercises, walking improves many risk factors for heart attack and stroke, including decreasing blood pressure, increasing vascular tone, that is, blood vessel muscle strength, decreasing weight and body mass index, or BMI, decreasing body fat percentage, and decreasing blood sugar. Walking is also associated with a 30% reduced chance of developing type 2 diabetes. For those with type 2 diabetes, walking decreased blood sugar, HbA1c levels, and triglycerides. One study found that, for those with diabetes, walking right after a meal, which is called post-meal walking, is very effective for lowering blood sugar. Another study found that, for some diabetics, post-meal walking may be as effective as prandial or mealtime insulin. Older walkers may have moderately increased bone density, improved strength, improved gut microbiota profiles, and, for those who walk a lot, lower dementia rates. Which begs the question, what does it mean to walk a lot? To measure the benefits of walking, many scientists use the number of steps a person takes. When counting steps, scientists have found that increasing the number of steps by 1,000 per day can lower the chances of cardiovascular events, like heart attack and stroke, and premature death by around 15%. These gains continue at pace until a person walks around 7,000 to 9,000 steps per day, which reduces the chances of events and premature death by 50 to 60%. These benefits are consistent in men and women and persist for years after a walking regimen is implemented. The speed of walking also matters, with those who take more than 1 step per second, or 60 per minute, having around 22% lower incidence of premature death compared to other walkers who take similar numbers of steps. Walking is also good for more than just your body. There is some evidence showing that walking may help lower symptoms of and protect against depression and anxiety. There is also emerging evidence that walking may reduce stress, improve well-being, and even decrease loneliness and isolation. Walking can improve sleep quality and may support better memory. These improvements come from an exercise that requires no equipment or skill needed to start. Exercising with a friend or in a group may also build and strengthen friendships and encourage you to keep showing up. So walking is pretty awesome, and walking a lot is even better. But is it as good as old-fashioned pumping iron? Well, it's very different. High-intensity training is more effective than walking at improving bone density and protecting against dementia in older populations. On the other hand, studies show that walking is about as effective as other exercises for improving lower back pain and disability, improving quality of life, decreasing fear, and lowering the incidence of cardiovascular events. The reason walking is so effective, even when compared to lifting weights, is because the muscles involved are huge. Now, when I curl a dumbbell, I'm using my huge biceps and strong, strengthy forearms to lift around 35 pounds. When I take a walk, I'm using all the muscles in my legs and butt and moving my full body weight. When you also consider the ease and low investment needed to take a walk, it's a real breath of fresh air. Thanks for joining us on this week's episode of MedEvidence Articles. If you'd like to know more, all of our sources are linked in the podcast description. You can also visit our website at medevidence.com and check out the MedEvidence podcast for discussions between physicians and subject matter experts. MedEvidence provides evidence-based information that empowers individuals to make informed health decisions. The organization stands apart in the presentation of unbiased clinical research in clear, accessible formats guided by medical experts. MedEvidence provides education for patients and healthcare professionals with a focus on research as a care option. Note that information provided in this podcast is for general educational, scientific, and informational purposes only and is not intended as and should not be treated as medical or other professional advice for any particular individual or individuals. If you are experiencing any medical issue or have any medical concerns, you should consult with a doctor or other medical professional. My name is Benton, and we'll catch you next week.